months since we were able to sit down with the governor last and have an in-depth conversation. While he was here touring the school, talking with students, taking some photo ops, and also speaking with staff and administrators, he did take time to sit down and talk about the issues, most specifically this pandemic and some of the frustrations that he is facing in this pandemic and those who are frustrated with him. This is stop number 6 on your statewide education tour. All districts are different, which is what helped you make the decision to say, look, superintendents, it is up to you. What is it that you're hearing the most, and how are the schools in southern Minnesota different from the metro ones you?
Yeah, it's good. Well, first of all, we knew that the wealth of knowledge that lies in the administrators and in the teachers. And I just have to say, talking to the school nurse, probably the thing that I've heard that's most gratifying to me, and I think most hopeful is that she said that what MDE and MDH, the Minnesota Department of Education and Minnesota Department of Health, of all of the scenarios they thought through and provided that packet and support to them, allowed them to execute in a way that she said she felt comfortable bringing kids back into the building. And I think one of the things you heard me talk about is the physical plant of it and the infection rates in the communities. Now, COVID's in all corners of the state, but what we've seen is and I think your listeners would attest to this, and it's one of the critiques that I think is fair as we deal with this is, well, our county only has 6 things. Why are we shut down? And there's truth in that. What Minnesota Department of Health would say in things like restaurants and all of that, you have people moving in and out, and it's not as much of a controlled environment. What I would say is, I have been convinced as we've moved through these 6 months, what we've learned about this is that there are certain principles you can put in place, which these school districts have done, that can reduce the spread and keep people healthy. I think the same thing can be said in businesses and other places of work. And I think that's what we're starting to see. And when this all started, it was my goal to make sure our hospitals weren't overrun, make sure we kept PPE on hand, make sure we were testing at a high rate, and then making sure that we could keep our businesses open. I think we're at a place in Minnesota right now where we have a sustainable model, which means we can start doing more things.
Back now live at Byron Primary School, where the governor visited earlier today on his back-to-school tour, talking to him about this pandemic and what has been happening with schools amidst the pandemic. But then the conversation turned as I asked him about his executive authority and critics, especially Republicans at the state capitol, who say it is time for him to give up that authority. So then the Republican leadership would say, when are you going to end the peacetime emergency and give up your executive authority?
Yeah, and here's what I would always ask is, be specific. Which part do you want me to give up?
Well, the peacetime emergency is not the issue that they keep saying they have a problem with. It's the fact that the executive authority and running the state started because you wanted to keep everybody safe. And we were in an emergency. And now that we are 6, now going on 7 months out, we're
still in an emergency, though.
It's still in an emergency, but that's where the gray area is. And that's what I want to get from you, because they're asking me to talk to you about it.
Yeah, no, and I'm asking them to help be a partner in this. What people need to know is every governor is using this authority. We're probably using it top quarter less than anybody else. The emergency authority I'm using has been in place the same amount of time as President Trump has put in place. What the things we're doing are things like ordering PPE and being able to get it quickly. If the legislature had to do it, it would take months.
But is the supply adequate now?
It is not. It is not. In terms of the country, no. That we're still trying to get
Minnesota.
That. In Minnesota, yes, we're solid, but I think you would ask nurses, we could do better as a country. Things like testing. So what I'm telling them is, help work with me on these things. What I just be candid with you, I said, I think most of these emergency authorities, if people were wearing masks and social distancing, we could start to change some of those numbers. So I asked Republicans in the legislature to carry the masking mandate. You guys put it through, and that'll be a signal to people that this is the right thing to do. No.
Okay, so no. Senator Gazelka last week, I interviewed him, and he said, we're done. We are done, because he said he has been very patient.
He's done with the virus?
No.
That's where they've been.
No. We're done with the governor's executive authority. We need to have a legislative body.
Yeah.
But we have to have the legislative bodies working together now, so it's not a unilateral decision-making process.
But just to be very clear, one of the things is, it's not so much the use of the powers, it's just they disagree with the solutions. And I said, when you can come to me and implement things that the CDC, the Mayo Clinic, the Minnesota Department of Health, and every other person in this thinks is the right move, and that's what we should do. I am not going to drop those powers and say anybody can walk in this building, nobody has to wear a mask, nobody has to wash their hands, and we're not going to test anybody.
But together with the three bodies, with the House and the Senate, and that's not working for you, so you're going to keep it. Do you have a timeline of when this will end the peacetime emergency?
Certainly when this virus is under control. I think the way you can tell it's under control, you can tell by positivity rate, you can tell by community spread, where are people getting this, you can tell by hospitalization rates, and I think you can tell by being ready for a vaccine.
People would say that our we know our hospitalization rates are much lower. Our death rates are not where they were.
If you ask people on this, Betsy, what is the hospitalization capacity now, say, in
But we're not hurting for beds.
What is the rate? It's 93%. So an influx of going from 5% positivity to 15% positivity would fill every bed within the first 2 weeks. And so the question here is many of these things are insurance. The idea that this is over and we don't need to do anything is what is the rub in this. We are in a good spot because we've done the things necessary. We do have the beds at this point in time, but the virus is not done. As much as I wish it was, as much as Republican leadership wishes it's done, you can't wish it away. And for me, as the governor, it would be irresponsible of me, certainly it would be easier for me, it would probably be politically a lot less of a hassle, but that's not what I got elected to do. And so what I would argue is our test positivity rates, our capacity in our hospitals, our folks who are not experiencing the long-term effects of getting COVID is improved because of the decisions we made. And as long as we need to do that, we should continue to do that.
Continuing now with my conversation with Governor Walz, who was here at Byron Primary early this afternoon. We were talking about the pandemic, his handling of the reopening of businesses. And when it comes to restaurants, business owners have been suffering. So I asked him why he allowed the health department to crack down on restaurants. Okay, with our restaurants, the compliance checks.
Yes.
The Metro restaurant owner yesterday in a news conference was talking about his $10,000 fine. When we were talking about, I was hearing you say when this all started, you know, we're asking restaurants, open safely. Will there be compliance checks? We don't know at this point, but it was going to be educational. Yeah. You know, and there wasn't going to be law enforcement. Now they're getting letters from the health department saying, you have to comply or we're going to come in and we're going to fine you.
And if that were salmonella poisoning, what would you want us to do? It's okay, just go ahead. We've asked people to comply. We know people are violating these things. They're CDC rules. What we've said is I don't want to turn the dial down. You know why? 99% of these folks are doing it right. And we're able to keep people in there. And when OSHA issues one, OSHA doesn't come in, and that's federal on this one you're talking about. They will come in and say this is in non-compliant. This isn't all that much different than making sure your kitchen is clean and you don't give someone food poisoning.
But then I've got the government in my kitchen, and then I've got a real problem with it.
Your government's in your kitchen every day. Every piece of food that comes into your kitchen has been inspected by a USDA food inspector.
Good point.
And so the question on this is you have a communicable disease, and the rub here is that, again, simply believing it's real or it's not. What I would say, and I want to be just very clear about this, no industry has been hit harder than the restaurant industry because of the nature of gathering together. And I would argue no industry has made greater strides and pains to keep people safe.
These are the ones that are hurting, and they come to us as the media and say, ask the governor why he would hurt us more. They say you are hurting them.
Well, I don't know what to tell them about COVID. Here's what I can tell you. States that do not have, just to be clear, there's no bars open in Florida. No one's eaten in a restaurant in New York since March. So this idea, what I would say to them is, in states that don't have capacity mandates, their reservations and the number of people eating out is no greater than it is here. You know why? Because people will go back when they feel safe. If you've got a restaurant that says we don't really care about social distancing, or if it were we don't care about cleanliness of our kitchen, people would not go there. Now the question that got asked is, can't we just count on people to do it on their own free will? I think people want to know that there's restaurants inspectors to make sure this is right. We don't go out of our way to do this. But the thing is, you have someone who was asked, they did it. They came in, whether it was OSHA or whether it was the State Health Department, and they found violations of this. What you don't see is the other 99 out of that 100 that did it right and were providing for it. So what I would ask is, it's gotten to the point in this country where it becomes a belief system. Science is not a belief system. It is either there or it's not, and it's provable. COVID-19 is real. It's a communicable disease. There are best practices involved, and we're trying to do those things. So I would just ask folks, help on that.
Gallup just came out with a poll saying, talking about governors all across the country. And Americans in general have a 60 to 80% favorability rate of how governors are doing.
Yeah.
That, any kind of news talking about high favorability must be good news, because things have gotten long and hard.
Yeah, no, and I just want to be clear, it's your responsibility, and I appreciate you doing it, asking these hard questions. And I want to tell Minnesotans, I'm as sick as this as they are. I'm tired. The things I love to do, I cannot do. It pains me when kids write to me, which they do, and they couldn't see their grandma on their birthday. Those are things that take away the quality of life. Not to mention the peripheral things of, I worry that our kids getting immunized for other childhood diseases because they're skipping going to the doctor. And so what I would tell folks is, we're in this together. I don't want to, and I want to be clear, I don't want to fight or pass judgment on legislators or Republican legislators. I just want to partner and try and find a middle ground in this. I think that idea of us working together to do it is absolutely perfect. And now if we can find a way that we can agree on that, but my pledge to the people of Minnesota is, I have to use the best guidance of those around me, the best science that's around me, and the best judgment to make sure we keep people safe. And I think maybe what folks see it is that governors have to be responsible. They have to stand in front of folks. And when we get it wrong, which I have to say that I got it wrong. And I can tell you right now, the idea of thinking about county-wide ways of doing this, I think is very appealing. And if our numbers get there, meaning that if you got a county that's low on that, low on infection rates, low on transmission, try and give them the flexibility to change some of their capacity and let folks do that. I think that's a real learning curve that all governors have been on.